what other important facts you should know about PSA? So I've mentioned lots about, the aim of treatment is to reduce disease activity, try to aim for remission, but obviously this is a long-term condition and things can evolve. And so sometimes patients can have flares, so you have ups and you have downs, and I'm sure some of you have already experienced this. So when patients have a psoriatic arthritis flare, they might feel more tired, their skin may be worse, they might have more joint pain and joint swelling. And there are lots of triggers for this. It could be that they're more stressed, or they may have had injury, or may have had illness that have triggered the immune system more. Not taking the medicine or not taking it appropriately can sometimes be the cause. And also having an unhealthy lifestyle, smoking and so forth can also trigger. So if you do have a flare, what do you do? Obviously, if you have a big flare, you call your doctor. So we have a helpline you can call and we can see you sooner. But there are things you can do yourself as well. So, heat or ice therapy could help. Some gentle exercise, avoiding your triggers. And eating healthily. So there are things that you can do yourself to see, if you can always take in some anti-inflammatories if it's a mini kind of flare. But if it's a flare that you can't control, then you need to contact your doctor and be seen sooner. So moving on to COVID-19, I think these days no webinar is complete without a slide on COVID-19. And so I've just written down a few questions that I get commonly asked, and I thought I should just address it first. So patients with arthritis, so PSA, but also other rheumatic conditions ask, am I more at risk of getting COVID-19 infections? I mean, this is still a relatively new disease, but the research has shown that in terms of all the autoimmune diseases that we deal with, when patients do get COVID-19, there is a higher risk of hospitalization and mortality. But with PSA, it's a bit tricky to say if it's, the condition or the treatment, or the fact that because it's more associated with obesity, heart conditions, and, the usual kind of risk factors of having severe COVID. Certainly you are at more risk. So you do need to take more care, and you definitely need to get your vaccine when you're offered. Okay. So can I still come to the hospital, to my hospital appointment? So we noticed that, during phase 2, obviously hospital attendances do go down, and that's quite understandable. Obviously the hospitals work very hard to try and protect patients and staff from getting COVID. And one of the initiatives actually that started during the circuit breaker the first time around last year was telemedicine. So all of us doctors now are very good at using technology to see our patients, and I think our patients are really liking it as well. So I mean, I can only comment on my own hospital. So at NUH, especially during phase 2, we do try to switch as many people to virtual, to telemedicine clinics as much as we can. And the format is that, you can have the blood tests at your polyclinic to say if you come into hospital for your blood tests. And then we do a telephone or we do a Zoom consultation at an allocated time, so your usual time. And then if you do need any more medicine, any top-ups or any changes, then we can actually deliver that to your house. So you don't have to come to the hospital at all. But obviously that needs to be supplemented with some physical visits so we can actually see you and examine you and so forth. So you can't just rely on that, but especially during these tightenings of restrictions, it is very helpful. And some of my patients really like it. And you can zoom in with family members from different places as well. So it's very convenient. Is it safe to get the COVID-19 vaccine? Yes, it's not only safe, you can and you should. Okay, so we recommend that you do take the COVID vaccine. I think initially there were a lot more restrictions, and now they're getting less and less. And I think now, unless you're actually allergic to the COVID-19 vaccine, anyone can get it. But if you're worried, then obviously do speak to your rheumatologist about it. If you haven't had it, you should have it as soon as you can, especially the elderly population. Could the vaccine cause a disease flare? So this is actually a question close to my heart, because we're actually setting up a national study on this at the moment. Because theoretically, if you're triggering the immune system with a vaccine, it doesn't have to be COVID-19 or it could be any vaccine, could it cause a flare of disease? And at the moment, there's no evidence from the studies that's been published to suggest that the COVID-19 would cause a flare of the PSA or any rheumatic conditions. But we're obviously still a new field, so we're still looking into that. But even if it does cause a flare, don't be worried, because we can just control the flare. It's more important that you get it. Do I need to modify my medicines, my PSA medication for the vaccine? The short answer is no. The medicines generally for PSA is okay. It's obviously sometimes a bit of a personal choice and something to discuss with your rheumatologist. But the national guidelines, the Singapore guidelines for rheumatology says no, you don't need to stop. So 2 more slides. I thought I should touch on pregnancy, because obviously this affects ladies at the childbearing age. And the first thing to say is that PSA doesn't affect your fertility, okay? So there's one drug called sulfasalazine that can cause a lower sperm count in men, but that's reversible, okay? But in women, the PSA or the treatment doesn't affect fertility, but some of the medicine can be harmful to the baby during pregnancy as well as breastfeeding. So it's very important that you do see your rheumatologist before you think about having a baby, so we can plan it, okay? Because if you are on any of the medicine, like for example methotrexate, we need to stop the medicine and then switch you to a safer drug before you can think about having a baby, okay? So there should be a run-up before you actually get pregnant, and we actually have an obstetrics rheumatology clinic to help with all of this, but it's important that we plan your pregnancy, okay? During pregnancy, the immune system tends to calm down a bit. So most of my patients find that actually they do quite well, and that the PSA is under good control during pregnancy. But it's actually after birth that the flares then happens. The immune cells then kind of ramp up again. So it's very important that you see a rheumatologist after birth, just to make sure we can keep an eye on you. So lastly, I want to touch on mental health. So given someone with a condition, a long-term condition that causes pain and tiredness, that can affect your mood, obviously. And there was a study by this in the US, I think North America, that looked at how it also impacts on other aspects of life. So how does PSA affect work? Obviously, a lot of patients may have difficulty sitting for long periods or standing for long periods, or they're missing work because of flares, or because of they have to take time off to see the doctor. So that obviously causes stress. And PSA can also affect relationships. So quite a lot of patients, more than half, do think that there is a lack of an understanding from family and friends about their condition, and they find it quite difficult to spend sort of quality time if they are having problems with their joints. But even though there's very high numbers of people having problems that could be causing, problems with the mental health, not many people are actually asking for help. So as kind of my last slide and the last word is that, having is all understandable. So, having a chronic condition can affect your mood, your confidence, all aspects of your life. And it's important to ask for help. And, as rheumatologists, we may not be able to help all the time, but we should be able to find someone who is able to help you. You can see the MSW, the medical social worker, see a psychologist, psychotherapist, so psychiatrist. So there's also things we can do to help. So please do reach out and speak to your rheumatologist, not just about pain in your joints.